growing cases of a type of gastro have prompted public health warnings across the country. The highly infectious stomach bug is mainly spread through bodies of water like swimming pools. Well, for more, let's go straight to the Chief Medical Officer, Professor Tony Lawler, who is in Canberra. Professor Lawler, good morning.
Good morning, James.
First of all, what is this bug and where are you most likely to pick it up?
So crypto or cryptosporidium is a parasitic infection. It exists in, as you say, predominantly in waterways, but it can be transferred through some dairy products. It's not an uncommon disease, but it is what we call one of the notifiable diseases. So if it is detected, state and territory health authorities notify that to our national notifiable disease surveillance system. So we're actually able to track the numbers of cryptosporidiosis quite closely.
So swimmers in a couple of states have been put on notice due to rising case numbers. But would a lot of people get this and then maybe not seek help? How bad are the symptoms?
So normally it's actually quite a mild disease. It presents with a gastrointestinal illness. I know it's a bit early in the morning to be talking about it, but it gives watery diarrhea, stomach cramps, and also on occasion respiratory symptoms such as a mild cough. But a lot of people have it and are completely asymptomatic. Interestingly, as you've highlighted, there were a lot of cases reported last year, just a shade over 14,000, which is a significant jump from our 5-year average. But interestingly, looking back over a longer period, say 10 years, we actually noticed that there was a significant drop in notifications of this disease during COVID. And that's probably for a couple of reasons. As you say, it's accessed through waterways and pools, and they were potentially used a little bit less frequently. But also it's one of the things that we can do to prevent it is to employ good hand hygiene. And we know that hand washing and the use of disinfectant was on the up during COVID.
Yeah, so 14,000 cases, as you say, last year, big increase from 2023. What's likely to be responsible? Are we just heading back to a more baseline normal, do you think, after COVID, or is there's something going on that is contributing to this?
Well, it is a return to post-COVID kind of presentations. As I say, it's about 5.5 times the 5-year average. But one of the things that we found is, we're only at the end of the first month in 2025, and we're finding that notifications within this period are kind of back to our expected range, although there can be a bit of a lag between diagnosis and notification. In terms of what the causes are, there are some cases that can be contracted and brought back from overseas. Just shy of 500 cases in 2024 were notified as that. We also find that the warmer weather potentially is a contributor, and also heavy rains, which obviously wash soil and dirt into natural waterways, which can be an issue.
Just before we let you go, Tony, a lot of kids going back to school today. All the best to the families who are grappling with that this morning. Ratty kids trying to call off after school. It's the end of summer. What's your advice to anyone who gets this bug?
So there are a couple of things you can prevent it. Good hand hygiene, trying not to swallow water when you're swimming, not going into natural waterways when there's been heavy rain, not drinking unpasteurised dairy products. They're the kinds of things that we like to think about. But also there are a couple of other messages I think are really important to drive home in summer. One is obviously be very safe and very mindful of dangerous waterways, but also be sun safe. So slip, slop, slap, seek and slide in Australia's summer season.